Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. Primary response that occurs on the first exposure to a specific antigen is characterized by option A. Rapid in appearance, more potency and longer duration. Options B. Rapid appearance, weak potency and shorter duration. Option C. Delay in appearance, weak potency and short duration. Option D. Delay in appearance, more potency and longer duration. The right answer is option C, that is delay in appearance, weak potency, and shorter in duration. Okay. The primary immune response to the primary contact of antigens are that delay in appearance, weak in potency, and have shorter durations. Okay. Let's see the difference between primary immune response and the secondary immune response. That primary immune response refer to an immune response of immune system that includes the productions of antibodies and cell mediated immunity, while secondary immune response refer to that immune response of the immune system that occurs in response to subsequent exposure to a particular antigen. Okay. Nave B cells and T cells responds to the antigen in case of primary immune response. Memory B cells only responds to the antigen in case of secondary immune response. And if we see that lag phase is long, that is 4 to 7 days in primary immune response. Lag phase is short, that is only 1 to 4 days in secondary immune response. That antibody label reach its peak in 7 to 10 days in primary immune response. Antibody label reach its peak in just 3 to 5 days in secondary immune response. That primary immune response take longer time to establish the immune response, while secondary immune response takes shorter times to establish the immune response. In case of primary immune response, a large amount of IgM and a small amount of IgG are produced, while in case of secondary immune response, large amount of IgG and a small amount of IgM, IgA, IgE are produced. Okay. Only few antibodies are produced in case of primary immune response, while 100 to 1000 times more antibodies are produced in case of secondary immune response. And if we see that this antibodies label decline rapidly in case of primary immune response, while antibody label remain same for a long time in case of secondary immune response. And this antibody show low affinity to the antigen in case of primary immune response, while this antibody show high affinity to the antigen in case of secondary immune response. This antibodies appears mainly in lymph node and spleen in case of primary immune response, while this antibodies mainly appears in bone marrow, then spleen and lymph node in case of secondary immune response. Both thymus dependent and thymus independent antibodies are involved in case of primary immune response, while only thymus dependent antibodies are involved in case of secondary immune response. Since the thymus dependent antibody refer to those antibodies whose productions from that B cells need that the activations by T cells at first, such type of antibodies are known as thymus dependent antibodies. Okay. Question number second. Western green method is used for the determination of option A, hemoglobin, options B, blood glucose, option C, erythrocyte sedimentation rate, or option D, RBC count. The right answer is option C, that is erythrocyte sedimentation rate. Okay. Western green method is used for the determinations of erythrocyte sedimentation rates. Since erythrocyte it measures the rate at which that red blood cells or erythrocytes in a sample of a whole blood fall to the bottom of that Western green tube. This falling is called sedimentations. Okay. And that high ESR value indicate that inflammation's condition. Okay. Let's say the normal ESR value of different species. In case of cattle, it is 0 to 3 mm per 8 hour. In case of goat, is 2 to 3 mm per 24 hour. In case of dog, it's 6 to 10 mm per hour. In case of horse, it's 15 to 38 mm per 20 minutes. In case of pig, it's 0 to 6 mm per 30 minutes. In case of cat, it's 7 to 27 mm per hour. Okay. Question number 3. The factor which will not affect the healing by regeneration is option A, the genus, family, order, or phylum of animal. Options B, the tissue or organ involved. Option C, nutritional status of animal, or option D, the age of animal. The right answer is option C, that is nutritional status of animal. The factors which affect the healing by regenerations include like the genus, family, order, or phylum of animal, as well as tissue and that organ that get injured. Okay. And the age of the animal. Question number 4. The thickness of the blood smear depend upon option A, size of the drop, options B, angle of the spreader, Option C, both. Options D, none. The right answer is option C, that is both. The three things that determine the thickness of the smear are that the size of the drop, larger the side, the thickness is more thick. Angle of the spreader, greater the angle, that the thickness is more great. Okay, and the speed of spreading, that slower the speed and more thick is that blood smear. Let's see the difference between a thick and thin blood smear. Okay, that thick smear is a lice RBC and it's of many layer, while thin smear fixed RBC and it is single layer. Okay, large volume of blood is needed in case of thick smear, while making thin smear only small volume of blood is needed. Okay, thick smear is good for screening test, that is either to find out that positive or negative conditions, while thin smear is good for that species differentiations. Okay, thick smear save time in examinations, while thin smear require more time to read. Okay, and thick smear is more sensitive since low density infections can also be detected as blood elements are more concentrated in thick smear, and in thin smear is less sensitive since low density infections can be missed. Okay, questions number 5. The normal range of hemoglobin in cattle is option A, 10 to 16 gram per 100 ml of blood. Options B, 8 to 15 gram per 100 ml of blood. Option C, 4 to 10 gram per 100 ml of blood. Or option D, 10 to 20 gram per 100 ml of blood. The right answer is option B, that is 8 to 15 gram per 100 ml of blood. Let's see the normal hemoglobin level in different domestic animals. Hemoglobin level in gram per 100 ml. In case of cattle, that is 11.23, which is if we see in range, then 8 to 15 gram per 100 ml of blood. In case of buffalo is 12.9. In case of horse is 11.5. In case of goat is 10.9. In case of sheep is 14.4. In case of pig is 11. In case of dog is 13. In case of cat is 12 gram per 100 ml of blood. Okay, questions number 6. Pantropic viral infections may often cause in peripheral circulation. Option A, leukopenia. Options B, leukocytosis. Option C, both. Options D, neutrophil. The right answer is option A, that is leukopenia. Pantropic viral infections refer to that viral infections which is not that specific to the certain types of cells. It can affect all types of cells. Such type of viral infection is not a pantropic viral infections. This pantropic viral infection may often cause leukopenia. Leukopenia, that is a decrease in that count of WBC in peripheral circulations, while localized pyogenic infections, that is bacterial infections, may increase that total leukocytes count, that is leukocytosis. Okay. Questions number 7. More than the normal number of nuclear lobe in neutrophil is called option A, age cells. Options B, shift to right. Option C, both. Options D, shift to left. The right answer is option C, that is both. The majority of that neutrophil has three nuclear segment, that is lobes, which is mainly connected by tapering chromatin strand. More than that normal lobes, that is that more than three number of nuclear lobe in neutrophil, signifying that shift to right, that is the more age neutrophils are present as compared to that immature neutrophils, while less than the normal number of nuclear lobes in neutrophils signifies shift to left, that is immature neutrophils count is more. Okay, questions number 8. Lupus erythematosus is a complex autoimmune disease of option A, human being. Options B, dog. Option C, both. Options D, cattle. The right answer is option C, that is both. Systemic lupus erythematosus, that is most common type of lupus, is an autoimmune disease in which that immune system attack its own tissue, causing widespread inflammation and tissue damage in that affected organ. It can affect the joint, skin, brain, lungs, kidney, and blood vessels. And it is a disease of both human being and as well as it is seen in dog too. Questions number 9. The cells which form the first line of defense against tumor cells and virus infected cells are option A, macrophages. Options B, B cells. Option C, natural killer cells. Option D, that is T cells. The right answer is option C, that is natural killer cells. Okay, the cells which form the first line of defense against tumor cells and viral infected cells are that natural killer cells, while the cells which form the first line of defense against Infections, actually bacterial infections or pathogens infections is neutrophil. Okay. Questions number 10. Basophilic stippling occurs in response to option A, anemia, options B, leukopenia, option C, leukemia, options D, intense erythrogenesis. The right answer is option D, that is intense erythrogenesis. Okay, basophilic stippling, that is precipitated strands of RNA, also known as punctate basophilia, is a presence of numerous basophilic granules that are dispersed throughout the cytoplasm of erythrocytes in a peripheral blood smear, indicative of that disturbed erythropoiesis. Okay. Questions number 11. The antigenic substance should have molecular weight. Option A 5,000, options B 7,000, option C A 6,000, option D 8,000 or high. The right answer is option D, that is 8,000 or high. The antigenic substance should have that higher molecular weight, that is 8,000 or more Dalton. Let's see some characteristic of antigen, that is immunogenicity. Antigens or immunogen has the property to elicit or induce detectable immune response first. Second, antigenic specificity, that's property of antigenic molecules to react only with the specific antibodies, that is antigenic specificity. Okay. Antigens are either protein or polysaccharides molecules. There is a note that hapten are the small molecules that cannot elicit that immune response alone. For that to elicit that immune response, it needs to bind with that the protein molecules. When it's attached to that larger protein molecule, then only it's able to elicit immune response. Okay. Questions number 12. Polycythemia means which of the following? Option A, increase in number of blood cells. Options B, decrease in number of blood cells. Option C, all. Options D, none. The right answer is option A, that is increase in number of blood cells. Increase in number of blood cells termed as polycythemia. Decrease in number of blood cells can be found in two ways. That's when there's a decrease in number of RBC, it is called erythrocytopenia, and when there's a decrease in number of WBC, it is called leukopenia. Okay. Questions number 13. Anticoagulant is option A, sodium hydroxides, options B, sodium citrate, option C, sodium tartarate, or option D, none. The right answer is option B, that is sodium citrate. An anticoagulant is a chemical that used to prevent blood from clotting. Anticoagulant are also used for blood thinning purpose too. Let's see some example of anticoagulants, that is EDTA, ethylene diamine tetraacetic acid. Heparin, heparin is a natural anticoagulant. Sodium fluoride, sodium citrate, double oxalate. ACD, that is acid citrate dextrose. CPD, that is citrate phosphate dextrose. CPDA, that is citrate phosphate dextrose adenine. CPDA with SAGM. Okay. Here in on the right side, we see there is a table which show the different type of clotting factor along with their name. Since this blood, when there is a rupture of that blood and when there is a hemorrhage, that blood clotting occur as in a cascade manner. That is a first clotting factor activate, then another clotting factor and another clotting factors and so on. In this way, this clotting take place. And this anticoagulant work either acting on either one of that clotting factor and stop that steps and stop that further clotting process. Okay. And let's see some that important clotting factors. There are 13 important clotting factors. Factor 1, that is known as fibrinogen. Factor 2, that is prothrombin. Factor 3, that is tissue factor or thromboplastin. Factor 4, that is calcium. Factor 5, that is proacylserine or labile factor. Factor 6 is, there is no factor 6. Factor 7 is proconvertin or stable factor. Factor 8 is anti-hemophilic factor. 9 is Christmas factor. 10 is Steward Prover factor. 11 is plasma thromboplastin antecedent. 12 is Hegeman factor. And 13 is fibrin stabilizing factor or transglutaminase. Okay. Questions number 14. The type of antibodies involved in Arthur's reactions are option A, IgM, options B, IgA, option C, IgG and IgM, or option D, IgE. The right answer is option C, that is IgG and IgM. The type of antibodies, that is immunoglobulin, which involve in Arthur's reactions, that is type 3 hypersensitivity reactions, that is immune complex mediated hypersensitivity reactions, is IgG and IgM. Since Arthur's reaction is an acute, Localized inflammatory immune complex mediated response. It is mainly characterized by erythema, edema, hemorrhage, and necrosis of skin. Okay. Questions number 15. Which antibody constitutes major sear in normal individuals? Options A, IgM. Options B, IgA. Option C, IgG. Options D, IgE. The right answer is option C, that is IgG. Let's see the different type of immunoglobulin in body. That there are majorly 5 type of immunoglobulin or body. This immunoglobulins are classified on the basis of their heavy chain. Okay. That in heavy chains of that IgM is that's mu. Heavy chain of that IgG is that term as gamma. Heavy chain of IgA, that is alpha. Heavy chain of IgE, that is epsilon. Heavy chain of IgD, that is delta. Okay. Let's see the structure. That if we see that structure, then IgM is a pentamer in structure, IgG is monomer, and IgA dimer, IgE and D also monomer. Okay. And if we see that antigen binding site is double as compared to that the structures for pentamer, that number of antigenic binding site is that IgM is 10. For IgG it is 2, IgA is 4, and IgE and IgD, that is 2 number of antigen binding site. If we see that molecular weight, that heaviest immunoglobulin is IgM, which is a 9 lakh Dalton. Uh, IgG is 1 lakh 50,000 Dalton, and the weight of that IgA, that is 3 lakh 85,000 Dalton, and IgE, that is 2 lakh Dalton, and IgD, that is 1 lakh 80,000 Dalton. Okay. And if we see that percentage of total antibody in serum, then we found that the among all immunoglobulin, IgG is found in abundant in serum. That is 80% of that antibodies in serum is IgG, that is 80%. Okay. Followed by IgA, which is also known as a secretory immunoglobulin. It's mainly found in secretions of that body. Okay. And IgE is known as allergic and antiparasital immunoglobulin. Okay. And if we see that the crosses placenta, then only IgG crosses placenta. And complement fixation, then IgM and IgG fixes a complement and start complement cascade. Okay. And FC binds to that. There's a two portion in then in that immunoglobulin, that is FC portions and FAB portions. This FC portions is bind to phagocytes in case of IgG, and in mast cells and basophil in case of IgE. Okay. Questions number 16. First change in the blood vessels during inflammation is option A, monetary constrictions, options B, vasodilation, option C, increased endothelial permeability, or options D, any of above may occur first. The right answer is option A, that is monetary constrictions. Since following inflammations, after inflammations, steps occurs as follow. First is there's a transit vasoconstrictions, which is a immediate vascular response of arterioles to inflammations. Then followed by progressive vasodilations, which is mainly seen in arterioles, but lesser extents involve venules and capillaries. This vascular expansion is the cause of redness, erythema, and warmth. Okay, followed by increased vascular permeability, and then there's a retardations of a blood flow, and there's a stasis. Okay, leukocytes extravasations and phagocytosis, and last is there's a fibrin formations. Okay. Questions number 17. Rigor mortis starts after dash hour after the death in an animal. Option A, that is 20. Options B, 14. Option C, 8. Options D, 16. The right answer is that is option C, that is 6. That is 8. In actual, that the rigor mortis start approximately 2 hours after death in a muscles of a face at first, progress to that limbs over the next few hours, and completed between 6 to 8 hours after death. Since among all options that 8 is near to that 2, therefore we choose that 8. Okay. Rigor mortis then stay for about that 12 hour and then disappear. Okay. While ulgar mortis starts approximately 30 minutes after death, and it's continue for the first 48 hour after typically completed by 18 to 20 hour after death. Okay. While liver mortis start 2 to 4 hour after death, become blanchable up to 8 to 12 hours after death, and fixed after 8 to 12 hours from time of death. Okay. Questions number 18. The normal range of total leukocytes count in horse is dash per cubic mm. Option A 4,000 to 10,000. Options B 6,000 to 13,000. Option C 10,000 to 20,000. Options D 9,000 to 13,000. The right answer is option that is B 6,000 to 13,000 per mm cube. Let's see that a normal value of leukocytes in domestic animal. In case of dog, that is 6 to 17 thousands per cubic mm, and in case of cat is 5.5 to 19.5 thousands per cubic mm. In case of cow, it is 4 to 12 thousands per cubic mm. In case of sheep, is also 4 to 12 thousands per cubic mm. In case of goat, is 4 to 13 thousands per cubic mm. In case of horse, is 5.5 to 12.5 thousands per cubic mm. In case of pig, that is 11 to 22 thousands per cubic mm. In case of chicken, is 20 to 30 thousands per cubic mm. And if we see that the dog, among all leukocytes, that's a mature neutrophil is in dominant number, that is 70% of leukocytes is neutrophils. In case of same, that cat is also, that is a neutrophil is a dominant one. 59% of total leukocytes is that neutrophils. And in case of that cow, that's lymphocytes is the dominant one. 58% of total leukocytes, that is lymphocytes. In sheep, that is also lymphocytes, which is 62%. In case of goat, also that is lymphocytes, which is 56%. In case of that horse, that is neutrophils, which is 49%. And in case of that pig, that is lymphocytes, which is 53%. And in case of chicken also, that is lymphocytes, which is 55 to 60% of lymphocytes. Okay. Questions number 19. Which chemical mediator of inflammation have origin from plasma? Options A, histamine. Options B, 5-hydroxytryptamine. Option C, prostaglandin. Options D, none. The right answer is option D, that is none. Okay, various chemical mediator of inflammations, their source and actions, we can see that there are cell-derived source, that is a histamine. Histamine is mainly produced from mast cells, basophils, platelets, and main function of histamine, that is vasodilations, and it's also increased vascular permeability and also called endothelial activations. Similarly, serotonin is also released from platelets and it also cause vasodilations and increase vascular permeability. Platelet activating factors is released from leukocytes and endothelial cells, also cause vasodilations, increase vascular permeability. Leukocytes adhesions, chemotaxis, degranulations, and oxidative burst. Prostaglandins also released from mast cells and leukocytes, cause vasodilations, pain, and fever. Leukotriene also released from mast cells and leukocytes, cause increased vascular permeability, chemotaxis, leukocytes adhesions, and activations. Cytokine, that is interleukin first and tumor necrotic factors, is released from macrophages, lymphocytes, mast cells, cause local endothelial activations. Chemokine, released from leukocytes activated macrophages, also cause chemotaxis, leukocytes activated activations. Reactive oxygen species released from leukocytes cause microbial cleaning and tissue damage. Nitric oxide, that is endothelium, released from endothelium and macrophages, cause vascular smooth muscles relaxations, killing microbes. While complement and kinin, these are the two chemical mediator of inflammations, which is released from that plasma. Okay, and they cause like leukocytes, chemotaxis, and activations, opsonizations, vasodilations, pain, smooth muscles contractions, vascular permeability, extra. Okay. Questions number 20. Fibrinous inflammations will be seen in option A, infectious feline enteritis. Options B, early stage of FMD. Option C, inhalation of dust or cold air. Options D, lateral stage of Corynebacterium pyogen infections. The right answer is option A, that is infectious feline enteritis. Fibrinous inflammations will be seen in case of infectious feline enteritis. This infectious feline enteritis is a disease which is caused by that parvovirus, feline parvovirus, also called feline panleukopenia virus. Okay. Questions number 21. The fluid cytoplasm outside the membrane of the endoplasmic reticulum is called option A, exoplasm, options B, hyaloplasm, options B, karyoplasm, options D, endoplasm. The right answer is option B, that is hyaloplasm. The fluid cytoplasms outside that membrane of the endoplasmic reticulum, that is hyaloplasm, while exoplasm and endoplasm, that is the two regions of that cytoplasms, where endoplasm is that inner granule rich dense part of the cytoplasm of cells, whereas ectoplasm is that outer non-granulated clear portion of the cytoplasm. while chiroplasm is that nucleoplasm. That's a plasm of nucleus. Okay. Questions number 22. Pathognomic lesions is which of the following? Option C, which indicate the cause of disease without doubt, which indicate the cause of disease with doubt, which lesions which develop in chronic conditions, or D, all. The right answer is option A, that is pathognomic lesions are those lesions which indicate the cause of disease without doubt. Okay. Let's see the pathognomic lesions of some important disease, like in case of FMD, that is tiger heart of calf. Option in case of rinderpest, that is zebra marking in case of large intestine. Swine, we say that turkey eggs, appearance of kidney, button ulcers, appearance in cecum and colon, and infracted spleen. Punched out ulcer in abomasum, seen in case of theileriosis. Negri bodies and presence of a Babe's nodules, that is seen in case of rabies. Okay. Questions number 23. Animal continue to suffer from the prolonged illness known as options A, recovery, options B, death, option C, both, options D, invalidism. The right answer is options D, that is invalidism. Animal which continue to suffer from a prolonged illness known as invalidism. Example of invalidism, sir, if we see that's Joni disease and TB. Okay. Questions number 24. Which breed of dog has high incidence of a brain tumor? Option A, boxer breed. Options B, cocker spaniel. Option C, Pomeranian. Options D, all. The right answer is option A, that is a boxer's breed. That's boxer's breed. Boxer's breed of dog has high incidence of a brain tumor. Here is the list of that common health problem associated with different breed of dog. That is in case of Siberian Husky, that common health problem is autoimmune disorder. Bulldog, we can see that is a respiratory problem. Pug, we can see eye problem. In case of German Shepherd, we say that hip dysplasia. Labrador, we say obesity. Beagle, we see that's epilepsy. Shih Tzu, we say wobbly kneecap. Boxer, we say cancer. Dachshunds, we say back problem. In case of Boston, we say cherry eye. Doberman, we see that's heart problem. In case of Cocker Spaniel, we see that's ear infections. Yorkshire Terrier, we see that systemic shunt. Golden Retriever, we see that skin allergy. In case of Poodle, we see that's glaucoma. Rottweiler, we see that joint problems. Green Great Dane, we see that blood. Pomeranian, we say that's hair problems. And Chihuahua, we see that's collapsing trachea. Okay. Questions number 25. Nephritis occurs more in option A, male dog and male cattle. Options B, female dog and female cattle. Option C, male dog and female cattle. Options D, female dog and male cattle. The right answer is option C, that is male dog and female cattle. Nephritis, that is inflammations of kidney, occurs more in male dog and female cattle. Okay. Questions number 26. Strangles occurs more in option A, young horse. Options B, old horse. Option C, all age group. Options D, cattle. The right answer is option A, that is young horse. Young horse within age group of 6 to 36 months are more susceptible to strangles. Okay, strangles, also known as equine distemper or infectious adenitis, is an acute infectious disease of equine, mainly characterized by there's a catarrhal inflammations of that upper respiratory tract with suppurations and abscession of that associated lymph node, mainly caused by streptococcal equi, which is gram-positive bacteria. Let's see the difference between strangles and glandar. Then strangle is an acute disease. Glandar is that chronic disease of a horse. And in case of strangle, there is a nasal mucosa, so inflammatory change only. In case of glandar, that nasal mucosa, so that's nodules and ulcer. Okay. Lungs lesions are not tubercles like in case of strangles. Lungs lesions are tubercle like in case of glandar. In case of that strangles, we don't see that ulcer on a skin. While ulcer on a skin, that is falciform, is seen in case of glandar. And if we take the pus from pus materials that containing gram-positive streptococcus equi in case of strangles, and pus materials contain only gram-negative actinobacillus melli in case of glandar. Okay. Questions number 27. Which breed is more susceptible to infections? Option A, Jersey. Options B, Holstein. Option C, Rathi. Options D, Guanxi. The right answer is option A, that is Jersey. Breed of cattle which is more susceptible to infections, that is Jersey. Milk fever is more common in Jersey breed of cattle. Ketosis is more common in Guanxi breed of cattle. Downer cow syndrome is more common in Holstein Friesian breed of cattle. Okay. Questions number 28. Melanosarcoma common in which of the following? Options A, brown and black horse. Options B, brown and white horse. Option C, gray and black horse. Option D, gray and white horse. The right answer is option D, that is gray and white horse. Melanosarcoma, that is cancer of melanocytes, is common in gray and white horse. Okay. Questions number 29. In pregnancy toxemia, fat content of liver become options A 3 to 4%, options B 10 to 12%, option C 200 to 300%, option C 35%. The right answer is option D, that is 35%. In pregnancy toxemia, fat content of liver become 35%, while in normal conditions, fat content of liver is 3 to 4%. Note, pregnancy toxemia in sheep is ketosis, while pregnancy toxemia in cattle, that is fatty liver syndrome. Okay. Question number 30. Water sickness occur due to option A, lack of water, options B, excess of water, option C, excess of protein, options D, lack of protein. The right answer is options B, that is excess of water. Water sickness occur due to excess of water, while salt poisoning occur due to that excess of salt. And the common that salt poisoning is common in both, that is we can say in pig and poultry. Okay.